Hi, my name's Catherine and I'm an orthoptist. I worked, and this is my AHP clinical academic story. So I worked clinically as an orthoptist for about 5 years before moving into the academic side. I really enjoyed and still do enjoy the clinical work, but at the time I felt that there were quite limited opportunities, particularly to specialise or extend my clinical practice. And I really wanted to sort of develop further professionally. I think research particularly, I had enjoyed it as an undergraduate. We had to do a research project as part of our final year, and I did really like the process. I think it must have lit a bit of an initial spark of interest at that point without me realising and coming along to it later on. I didn't actually have a specific clinical question that I was really desperate to answer. It was more a case of wanting to broaden my impact a bit and explore new opportunities rather than having a particular topic that I was most interested in. I would say that my head of department in my NHS job was really quite a key influence for me moving into the academic side. She'd completed a PhD herself, and she really encouraged me to consider research opportunities, and she had kept an eye out for PhD projects that were being advertised as well, and would send them my way to have a look at. And I think looking back, that support was really crucial, and without that encouragement and the initial nudge, I probably wouldn't have actually considered a PhD in the first place. So I think she's also made it possible for me to keep clinical contact during my research and going on from that. So I really do think without that support, I wouldn't even have considered it. My PhD journey and the research side, I entered the research quite traditionally. There was a predefined project that was advertised, which sounded quite interesting. And I applied for that and was successful in getting the funded place. And I think during my PhD, definitely developed a lot of research skills and a lot of experience, and some additional skills, including computer coding that I wasn't certainly didn't have any knowledge of before I went in. My research specifically looked at using a low-cost eye tracker to use as a clinical assessment tool, and in rehabilitation in patients following visual field loss, most specifically in patients following a stroke and in patients with macular degeneration, and looking at ways to assess as well as to possibly provide training to help them cope with the visual field loss that they are left with. Moving into the academic side towards the end of my PhD, my funding was running out. I hadn't quite finished, and the lecturing post was advertised. For me, the timing wasn't really ideal. I was still finishing off my PhD. I really wanted to maybe be a little bit closer to the end at the time, but there are only 4 universities in the UK that train orthoptists. So to go into a lecturing role, it was really too good an opportunity to not apply for, and I was successful in getting that role, which has been brilliant, really, even if it meant it extended my PhD completion by a fair amount. Currently, I split my time between a university lecturing post, and I keep one day a week in NHS clinical practice. And I think for me, it's really important to maintain both roles. It definitely keeps me connected. The clinical work keeps me connected with patients' care and real world practice, which I think is really important, not just for teaching the students, but also for further research as well that I hope to go on to. The academic role obviously allows me to teach and research and hopefully contribute to the evidence base as well, which is obviously so important. From an impact perspective, as my research changed practice, certainly hasn't changed the world. I have only just recently submitted my PhD thesis, so I'm still really quite early on in my research career. And I would like to think that further down the line, that my research does start having an impact and starts to develop that impact. I really hope to build on my PhD findings, as well as now further collaborations for that will hopefully then translate into future clinical benefit. And I hope that my research will certainly support more accessible assessment rehabilitation tools for patients with visual field loss as well. I think currently, from a benefit perspective, undergraduate students that I teach definitely benefit, again, from the additional skills that I've learned through my PhD. But as with all AHPs, evidence-based practice is really fundamental to our profession. And I think my PhD has certainly strengthened my ability to critically evaluate the evidence and question and establish practice as well. And most importantly, I suppose, identify the gaps in knowledge and where the research still needs to be done, and start sort of bringing up those questions. And I really hope that I am equipping the students with those same skills as well, and making them ask those questions, and really consider the evidence that is available or not available. In the future, I really hope that, again, that my PhD research goes on to more, and I get to do more with that and take it further, and also provide the profession with sort of that strengthening evidence base, even if it's through smaller projects, but just answering those even small questions that haven't been looked at yet. There's still plenty of unanswered questions. And I really hope that future clinical academics, through encouragement and get the interest, and can see how enjoyable it can be through, hopefully, the enthusiasm that I give for the job that I'm doing. I think, looking back, definitely the mentorship and support were really critical in me moving into the academic side. And I think it just shows how important it is to encourage people who may not initially see themselves as researchers, but someone else has obviously spotted that in them, and give them that nudge and that support to take the leap and move into quite a new and probably quite a daunting, certainly felt quite daunting for me, area when we're so used to the clinical side. My career is still very much in its early stages, and carrying on balancing the clinical work, but also the teaching and the research is very busy, but it is also really, really rewarding, and I do really enjoy it. So I hope, again, that I can pass on that enthusiasm to the students that I teach, and hopefully expand the research. I very much intend to maintain a clinical role alongside the academic role. I think for me, I really enjoy the balance of it, and of course I hope to build on my PhD research as well, continuing to improve the evidence-based practice in my profession too, and hopefully through my lecturing posts, hopefully inspire the next generation of AHP clinical academics as well.